Yeah, absolutely. I mean, adults, and quite often we see them and they've got severe problems, they've got huge crowding, teeth severely displaced, and they're often the ones that, when we complete their treatment, they look absolutely amazing. They've really, in the space of 12 months to 2 years, they can undergo a huge transformation with perfectly straight teeth. And the difference in how they feel about themselves, and the way that they carry themselves is unbelievable.
Yes, my oldest patient is 75. She's probably about 80 now, but terrific lady, and it's so rewarding treating adults, because a lot of adults think that braces or fixing your teeth and giving yourself a beautiful smile is something just for teenagers and young people who are growing. They may have been in a situation where their parents couldn't afford it to do it for them, and they just put up with their crooked teeth, and their whole life they wanted to have a straight smile and a beautiful smile, and finally they do. We can fix it for them and give them a terrific smile, and their self-esteem, adults are usually fairly confident anyway, but their self-esteem still improves, and they love to smile. They smile differently because they want to flash their new grin to the world. So it is really, if you're an adult watching this, or an adult that would benefit from a really nice smile, please tell them that it's so possible and it's so rewarding for all concerned. It's great to help out.
We quite often have parents and the kids go first, and all the kids will be treated, and then they go, well, it's my turn now. And so they'll often get some treatment done after the children have been treated also.
Yeah.
And so everyone's walking around, beautiful, happy family.
And there's so many aesthetic or cosmetic options for adults. They don't have to have the old metal braces. They can go for the clear braces on the outside, or the braces are completely hidden on the inside, or in certain cases where it does work, the Invisalign aligners, which are clear aligners that you change every 2 weeks, take them in and out. So there's many options for adults to help them get their smile in the most cosmetic way, so it's not intrusive at all on their life, and the end product is a terrific happy adult.
And it's interesting, quite often I get asked, well, isn't it going to take longer because I'm an adult? Generally you find that perhaps in adult cases they might be 1 to 2 to 3 months longer than a child, but in fact there's very little difference in treatment time for most cases. So it shouldn't be really a barrier. Some people say it's going to take twice as long because I'm twice as old. That's not true.
I think part of the motivation, the reason for that is that the adults are usually more motivated to be there, so they want to be there. Unlike some of the teenagers who forget to wear their elastics when they have to wear elastics or brush their teeth, the adults are really focused. They want to finish in a shorter time as possible. They're also the ones who are actually paying for their treatment, so they have every reason to want to get the very best result. And adults definitely are a fantastic group of patients in our practice, and I'd say that about 30 to 40% of our patients would be adults, which sounds surprising, but it's a big part of the orthodontic population, not just in our practice, but practices possibly internationally.